My responsibility today is to tell you why a stable pseudoarthrosis, unlike contemporary thought, is not a contraindication for participate in collision sports. My only conflict is that I'm the team spine physician for the Philadelphia Eagles, and cross your fingers they do well this year. So we know that pseudoarthrosis is common in lumbar spine surgery, cervical spine surgery. If someone says, what's the chance of having a non-healed fusion? It's 0 to 20%. More predictable if you use autograft, less predictable with allograft. We all use instrumentation nowadays. Very rarely do we not. And if you look at every single study, there's debate on what's the best imaging study, CT scan, flexion extension imaging study. Some use MRI scan, but everything looks at it 0 to 20%. So we know that's what we see out in the literature. But there's no consensus on how do you manage someone that comes back and has no significant pain and feels great, and you get an x-ray and you see a pseudoarthrosis. Some people say do nothing. The vast majority of people say do nothing. Some people say, well, the instrumentation may fail. What do you do? Well, that's what we're going to talk about today. What do you do in a professional athlete? The first question we have to ask ourselves is, why does the person have any pain if someone has a pseudoarthrosis? Well, many studies have looked at histological studies in animal models. Some might have identified nerves that have grown into the bone adjacent to the non-healed fusion site. Some thinks it's due to microtrabecular fractures at the level of the healing fusion. Some think it's due to the fact that there's motion and you have synovitis in the facet joints. But we haven't been able to prove it's due to instability. A lot of interesting studies have looked at people who have a non-healed fusion at a year, asymptomatic. They've called them back a year later, and the vast majority of those people have gone on to healing. So healing process can take 1 to 2 years. And if you look at the VAS scores at 1 year compared to 2 in those that have a fusion or not fusion, they improve. And there's no significant difference between those who have fused and those who have not fused. Does a pseudoarthrosis portend an unsatisfactory outcome? No. If you look at all the studies, there's really no difference between someone with a solid fusion and someone with a non-healed fusion in the cervical region. That may not be the same in the lumbar region, but in the cervical region, in some studies, 93% of non-union patients had a satisfactory outcome. 80% of patients with a non-union never need to have repeat surgery. So you have to keep that in the back of your mind. And a major complaint is never recurrent arm pain. Those that are symptomatic that come into my clinic have like a throbbing toothache pain in their neck. So 90% of patients who have a pseudoarthrosis will eventually end up going back to work. So keep that in the back of your mind. Now, this is an interesting study. It looked at a human cadaver model, and it looked at confirmed pseudoarthrosis that was fixed with an anterior cervical decompression and fusion, and then one that had an anterior and a posterior procedure, and they did stress testing. There was no difference between range of motion between a non-healed model, a solid anterior cervical decompression and fusion, and an anterior posterior. No difference in motion. So keep that in the back of your mind. And I can't think of a better instability model with motion than having a disc arthroplasty. Here you actually have motion. So the question is, would you let someone with significant motion go back to clinical collision sports? So keep that in the back of the mind. But if you look at the world's literature and you look at athletes that are doing a lot of motion, those that can have trauma to their head, such as soccer players, people in martial arts, and this is what this study looked at, they all returned safely to collision sports. But what about someone who's wearing heavy helmets, like a football player? Or better yet, someone in the military with all that gear? Well, they go back to work quicker than someone that has an actual fusion without any significant published adverse events. Now, can a professional athlete who's getting hit all the time go back to play? Yes, there's been a case published in the literature. Wrestlers, football players, hockey players. The imaging studies in this particular patient were horrible. If you saw the x-ray, you'd be like, oh, that's a definite non-healed fusion. Instrumentation looked cockeyed, went back to play for 4 successful seasons. So it's been out there. You can go back to play with a non-healed fusion. So what happens if you say, I'm worried? Let's reoperate on the patient. Well, if you go anteriorly, soft tissue problems, swallowing problems, loss of voice function, all sorts of things can go if you go anteriorly. And God forbid you go posteriorly. There's nothing more painful than a posterior approach, mobilizing the paraspinal muscles. 50% of patients may have discomfort from that. So I would avoid it. So what do? If a patient comes in with a non-healed fusion, asymptomatic, with no instability, they can play football. I'm not against it at all. If they continue to have neck pain, possibly, but I tell them, I said, listen, your neck pain may worsen. Even if you're asymptomatic, it may worsen, but that's it. It may worsen neck pain. You're not at risk of a traumatic neurologic deficit. There's been no published case reports of that. So number one, subjective outcomes are the same between fused and unfused patients. The biomechanics that we have, it's stable. It's not an instability model if you go on to have a non-healed fusion. When you put a disc arthroplasty, you have much more motion, and we're letting those go back to collision sports. So why can't you do it with a pseudoarthrosis? So in selected cases, in someone who's really not symptomatic, let them play football, let them play soccer, let them play hockey. It's not a problem. Thank you.